It is the fastest growing cancer in women right now. And the women that are most likely to get it are the women that are in the prime of their lives. So 30 to 50 years old, when they're busy taking care of their kids and their jobs and they're not, thinking about themselves, those are the women that are getting diagnosed with thyroid cancer.
Welcome to the podcast where motherhood meets reinvention. I'm your host, Sharon Macey, and this is Mom to More. I speak with remarkable moms who've embraced the art of reinvention, crafting their more by leveraging the skills they honed as stay-at-home moms. They share their experiences, struggles, and successes as they return to former careers, rediscover old passions, and chart entirely new paths, offering you the motivation and inspiration to help you answer the question, what do you want to do when your kids grow up? Hi, it's Sharon. Welcome back to a new expert episode of Mom to More. Here's something that may surprise you. Many women are walking around right now with undiagnosed thyroid nodules, and they have no idea. Today's guest is on a mission to change that, and this episode is essential listening for all women. I will tell you this much. This one is really personal for me. But let's meet her first. Dr. Rashmi Roy is nationally recognized for her groundbreaking work in thyroid cancer screening. She leads a large community-based thyroid ultrasound program focused on asymptomatic women, research that is actively shaping the conversation around making thyroid screening more accessible and potentially standard practice. A Johns Hopkins trained endocrine surgeon, Dr. Roy completed her surgical residency at New York Presbyterian Hospital and is one of the highest volume thyroid surgeons in the United States. She previously led the thyroid program at Penn Medicine, Princeton Medical Center, and served as assistant professor of surgery at Rutgers before joining the Clayman Thyroid Center. She also reaches over 83,000 subscribers through her Goiter Guru YouTube channel. That's amazing, where she educates patients on thyroid health and treatment options. Dr. Roy, welcome to Mom to More.
Thank you so much for having me. I'm so excited to be here.
Thank you. Thrilled you're here as well. And we have to give a shout out to Mom 2.0 in Austin, where we met. And when we spoke, I realized that we had to record this expert episode together because I know it would benefit every mom listening.
Exactly. It was meant to be, for sure.
So let's jump in. So is thyroid cancer rising in women? And who is most at risk?
Yeah, absolutely. It's a great question, and it's so important for women to know. It is the fastest growing cancer in women right now. So we're finding it more and more in women. It's the fifth leading cancer in women. And the women that are most likely to get it are the women that are in the prime of their lives. So 30 to 50 years old, when they're busy taking care of their kids and the prime of their lives and their jobs, and they're not, thinking about themselves, those are the women that are getting diagnosed with thyroid cancer.
Interesting. And sorry, so prime of their lives, is it genetic related? Is there family history? Is it cultural? Does any of that play into it?
So, there's two known risk factors for thyroid cancer. Number one is a family history of thyroid cancer. And I'm talking about through generations, not just, oh, my aunt had thyroid cancer. It's your mom, your grandmother, and several generations. That's a family history. And the second risk factor is a history of radiation. So not just a CAT scan in there, but, radiation exposure, like for breast cancer treatment, or, radiation events like Chernobyl and things like that. So we're talking about very high levels of radiation. But that being said, 90 to 95% of my thyroid cancer patients come in and have no history of any of that. So those are the things that we know is a causative factor. But, the other things, what I think is important or what is being studied is obviously there needs to be an estrogen link to it. If it's happening more often in women, it's 3 to 4 times more common in women than men. So I think estrogen is a factor, but it hasn't been scientifically linked yet.
Interesting.
And, there's got to be environmental factors, again, stress, things like that, like with any cancer. But again, not scientifically linked yet.
Interesting. But you're at least seeing this what is the term they use when it's just clinical, right?
Right. It's clinical.
Okay.
It's associated.
Associated. Okay.
But not causative.
Understood. Understood. So can you explain the difference between, because this got me confused, a thyroid goiter, a thyroid nodule, and then thyroid cancer?
Yeah. So a lot of people intertwine those terms. So a thyroid nodule is just a growth within your thyroid gland. You could have just one nodule, you could have several nodules, and they could all be benign. A goiter is an enlarged thyroid. So you can have a goiter that for different reasons. You could have a multinodular goiter, which means, to bridge in what we just talked about, multiple nodules, growths within your thyroid gland that makes the thyroid enlarged. So now you have multiple nodules causing you to have an enlarged goiter or enlarged thyroid. So that's a multinodular goiter. You could have something called Hashimoto's or Graves' disease, which are autoimmune diseases of the thyroid gland that causes enlargement of the thyroid. So that would be a Hashimoto's goiter or a Graves' goiter. So goiter is just enlargement, and there are multiple reasons that you can have one. And then thyroid cancer is when one of those nodules or several of those nodules are not benign and obviously have gone through malignant transformation where the nodule has turned into a thyroid cancer.
What percent of the screenings that you do are actually cancerous versus benign?
So I think there are two things that are really important. Number one is that most thyroid nodules, 90 to 95% of thyroid nodules are benign. So don't panic. So if you have a thyroid nodule,
don't panic, folks. Yeah.
Don't panic. However, when I do my screening program, what I have determined through all the research I've done over now 4 years is that the detection rate for thyroid cancer in asymptomatic women that have no history of thyroid cancer, no symptoms, have no idea, is 2.4%. And so that may not seem very high, but if you look at mammograms and pap smears, which are protocol, their detection for malignancy is less than or equivalent to 1%. So thyroid screening has double the detection rate than what is already protocol. And nobody talks about getting a thyroid ultrasound as part of preventive screening for women.
It is the easiest thing you could ever do.
Right. Yeah, we do it, right?
Yeah, right.
Mobily at this program. You've done it. Well, I've done it for many reasons, but you've seen it at the screening program.
Right. You literally sit there and they take the little wand and they put it on your neck. For those of you on YouTube, you can see me doing that. And it's super, super easy. So let's talk about what symptoms should we all be on the lookout for? And also, this is probably pretty classic women. Why do most women dismiss these signs?
So number one, thyroid cancer for the most part is asymptomatic. So you have no idea that you have it, right? But if you have symptoms, it is going to be you feel or someone feels a lump in your neck, somewhere around where your thyroid is, which essentially, if you see this sulcus right here, your thyroid is 2 finger breadths above it. So, feel around there, or your doctor feels around there and they feel a lump, or they're feeling your neck and you feel an enlarged lymph node. So feeling a lump or a bump in your neck, that's a symptom. Clearing your throat when you're not sick, if that's a repetitive symptom that you identify with, that could be a nodule that's irritating your trachea. So that's
interesting.
something to think about. Again, coughing if you're not sick, again, irritation of your trachea.
But if it's not like a nasal, like a sinus thing. Okay.
Right. So you have no drainage, but you're just like, a lot of patients, I'll talk to them and they'll say, people are so annoyed with me at work. I'm just clearing my throat all the time.
Oh, interesting.
So lump in your throat, clearing your throat. And then, more aggressive signs are voice changes. So the nerves that go to your vocal cords, they travel right underneath the thyroid gland. If you're experiencing hoarseness, that's a significant sign. That may mean that the cancer has invaded the nerve to your vocal cords. That's a much more progressive sign of thyroid cancer that we don't like to see, but we see. So those are kind of the three main things.
Right. Okay. And does thyroid disease show up in blood work? And if not, why not?
Yeah, so this is what shocks everyone that comes into my office. So you can have a neck full of thyroid cancer, meaning you have thyroid cancer, it spreads through your whole entire neck, all the lymph nodes, and your thyroid blood work is normal. You take
That's
no medication
crazy.
and it doesn't show up. And women are shocked. And thyroid cancer and thyroid function do not go hand in hand. So the thyroid blood work that you're getting, that's a marker of your thyroid function health.
Mm-hmm.
It's not a marker of whether you have thyroid cancer. So that's the biggest thing. You know, even at these screening programs that I do, I'll say, oh, you want to get your thyroid screen? They'll say, oh, I don't need to. I just got my blood work and it was totally normal. I say, no, you know, that doesn't tell you anything about what's actually going on with nodules or thyroid cancer. So it's super important to know that. There is a tumor marker in your thyroid blood work, but that tumor marker called thyroglobulin is only a tumor marker after you've had the thyroid surgery, not beforehand.
Why is that?
So thyroglobulin is made by thyroid only. So if you've had a thyroid cancer operation, and some patients need their whole thyroid gland removed for thyroid cancer, not all patients, I can potentially cure you by just taking out half. But if you've had your whole thyroid gland removed, your thyroglobulin level should be 0, right? You don't have any thyroid tissue, your thyroglobulin level should be 0. If your thyroglobulin starts creeping up, that means that now that's kind of a yellow flag, a red flag that you have a thyroid cancer recurrence. So your thyroid is growing back. So after a thyroid cancer operation, your endocrinologist will monitor you with thyroglobulin levels. So that's super important for a tumor marker. But your thyroglobulin levels pre-surgery are probably either normal, they may be elevated. You know, I take out huge goiters, you know, this big in patients' necks. Their thyroglobulins are in the thousands, but it's all benign. It's just a marker of having thyroid nodules. So, you know, really important distinctions to make.
Absolutely. Hey, Dr. Roy, we are going to take a quick break. And when we come back, we will talk about the importance of ultrasound screening. Don't go away. Quick pause to welcome a new local sponsor, Wild Radish Eatery in Nyack, New York. I've been getting their weekly home deliveries, and it's a total game changer, bringing organic, slow-cooked seasonal meals, baked goods, and seriously delicious snacks right to your door in the tri-state area. Everything's gluten-free friendly, mostly vegan, and made by real humans, not a factory. So whether you're postpartum, postmenopausal, or just done thinking about meal prep, go to thewildradish.com and use MTM20 for 20% off your first delivery. And another everyday favorite I swear by, our longtime sponsor, Ally Shoes. These are some of the most comfortable shoes I've ever worn. They're designed by women, for women, finally, right? And thoughtfully placed padding that actually supports your feet all day long. And I'm not the only one saying it either. InStyle, Pure Wow, and HuffPost all rave about them. Flats, boots, heels, you name it. And yes, there's a great origin story behind the brand, too. Head to ally.nyc, where listeners of the pod get $40 off your first pair of heels with code MOMTOMORE40, and 10% off your first pair of boots and flats with code MOMTOMORE10. Ally is reimagining how comfort and function support women every day, and I love that. Hey, we are back with Dr. Rashmi Roy, endocrine surgeon, and we are talking everything thyroid today. So, Dr. Roy, we talked a little about the importance of ultrasound screening, and I will point out that the conference that you and I met at, you performed literally hundreds of ultrasounds in 2 days. Did you learn anything different from that relatively small population of ultrasounds? And I think at this point, you can probably tell, even just from looking at it, if it's problematic or not.
Correct. Yeah. So just to kind of give everyone an idea of what the program is. So I literally take my team to wherever we're screening people. It's a mobile ultrasound, and, you know, it's just literally a minute ultrasound. And then we print out the picture for you. And I look at what every single every single woman's ultrasound looks like, what the nodule looks like. There's suspicious characteristics that I look for to tell you if your nodule needs further workup, which would be a biopsy. Certain characteristics, I can look at and I know, that's a thyroid cancer. But, what was most important is that the statistics were the same. So I screened over 400 women at over 2 days at the Mom 2.0 conference.
You guys were really busy at that conference. Yeah.
And the statistics were the same. 2.4% of those women had thyroid nodules. A lot of those women, they haven't followed up with me, or they went to their local doctors because it was a national event, and some women, from California, all over. But I can almost guarantee, even though I don't have the biopsy results of each of those women, the way that it looked like on ultrasound, it was 2.4% had a thyroid cancer.
What was so amazing about that conference was every time I walked by your booth, there was a line waiting to get thyroid screened. And I thought, but how fabulous is that? Because 400 women, roughly 400 women, I know there were a few guys thrown in there, now have that information about their thyroid that they didn't have before. So either they have the information that they know they need to take further steps, or they have the other information that they're like, okay, you're good for now. How frequently should people have their thyroid ultrasound?
So I think, especially for women, I think everyone at the age of 30 should have a screening ultrasound. Just see what your thyroid looks like. And then
like
if
a baseline.
just a baseline. And if your ultrasound is fine at that point, then maybe 5 years later, get another ultrasound. But if you're diagnosed with a nodule, then it should be, depending on how suspicious it is, every year, you should just monitor it with an ultrasound. If it's a small, 8 millimeter benign appearing nodule, then you can maybe do every 2 to 3 years.
Okay. Good advice. Good advice. So let's talk about what happens when you get a diagnosis. And here, folks, is where I wanted to share why this is so personal, because in my case, I almost missed it entirely. I mean, I wasn't even looking for a thyroid problem. I had heart palpitations. I'd love to know how common that is. It was a cardiologist who actually sent me for an ultrasound, and that's when the nodule was found for me. So Dr. Roy, for the woman who gets that call, that moment when something shows up, what does she need to know first?
Yeah. So the number one thing is take a deep breath. Don't panic. For the most part, this is a completely curable disease. The cure rate in an expert surgeon hands should be close to 100%. So that's number one. You just need to take the next steps. So if you find out that you have a suspicious nodule on ultrasound, number one, do your research. Find an expert thyroid surgeon, an expert thyroid endocrinologist who, for the majority, all they do is thyroid. You don't want to be going to the endocrinologist that just does diabetes and maybe sees a thyroid every once in a while, or a general surgeon or an ENT that does sinuses all day long or hernias all day long and once a month does a thyroid surgery. So number one, take a deep breath. Number two, find an expert. And number three, your next step in your evaluation is a biopsy. It's super easy. It's just a needle that goes into the nodule. And then you'll get a diagnosis of what the nodule is, and then, recommendations.
Got it. Thank you for that. I also want to point out that when people come see you, like I think a lot of people think, and I thought that too, like when it happened to me, you stay local, but you don't have to. And I want to point out that people travel from across the US and internationally to see you, which I think is really important for people to know. You are not tied to your local endocrine surgeon. And especially if you don't feel comfortable with someone, like I know that I had interviewed several doctors, and there were some doctors that I met where I was like, no way is this doctor touching my neck. I did a little research on you and found out that your work has been described as, I will quote, flawless, and that you are a super surgeon, which is high praise, to be sure.
Yeah. I mean, again, you do your research. I mean, 80% of my practice is out of state. So I'm located in Tampa, Florida at the Hospital for Endocrine Surgery, but 80% of my personal practice is out of state. So yeah, people fly in, you could fly in. We streamline the whole process for our out-of-state patients, where I evaluate you. diagnose you, and operate on you in a single day. So you can come in, I do the evaluation, you're cured of your thyroid cancer and in your hotel in the same day. So it's pretty special about, our practice here. But number one, you don't have to go to wherever your primary care doctor referred you to. You don't have to stay local. Just do your research. So what's so, now it's 2026, medicine is a business. There's Google reviews on surgeons, Google reviews on doctors, just like a restaurant. And I think every patient should look at Google reviews on who's going to be operating on them, just like, you're going out for dinner that night. It's just the day that we're in,
It's kind of funny when you phrase it that way, right? You check out Google reviews for the restaurant you're going to and also for the surgeon who's going to be, yeah. And what is the typical, from what you see, because I know that in the years since I had it, things have changed, right? I think the way they do it has changed. Or is it now outpatient surgery now?
Yeah. So if I take out half a patient's thyroid, which is always what I try to do, I try to save as much as the thyroid as I can, then it's an outpatient procedure. If I have to take out the whole thyroid or do more of a neck dissection, they just stay in the hospital one night. And then I just want them close for 2 days. Just God forbid there's any issues. I want them to be close because I can't help them if they're, across the country. Sure. And really the most urgent issues, if anything is going to happen within those 48 hours. So I keep them close in a hotel and then they can fly out. And then everything after that could really be managed over the phone. If there's redness or something, I call them in antibiotics or, whatever the situation may be.
And do you use stitches or do you use like the surgical glue?
So both. All the stitches are on the inside. And then there's a glue on the outside. So there's nothing that there's no wound care. The glue stays on for 3 weeks and then it falls off. There's no stitches that need to be removed. I do a plastic surgery closure. So you notice the incision for about 2 months as it heals and then it just fades away into a thin line. People are scared of the scar. We pay a lot of attention to it because I know that that's all that you see,
Oh yeah. I know when it happened to me, I would look at myself and the only thing that I would see was on my neck. Right. Yeah. And times have really changed. So let's talk about our present screening system in America. Who are we missing and why? And what can we do to get women to really understand, and other doctors, right? Even their local endocrinologists, that this is a really easy way of determining something that could be, obviously if caught early, it's so easy to cure.
So I think we're missing everyone, right? Because it's not happening.
Yeah.
The reason why, this is so passionate for me is because of the detection rate. And there have been studies. This screening has been studied before. It has been studied in Korea. It has been studied in the United States over 10 years ago. And the reason why screening is shot down by the medical community is for the worry of overstimulating the healthcare community. Meaning, okay, you're finding all these nodules. Now these women need to get biopsies. But that is also why I limited my study to nodules that are 1 centimeter or greater. Okay. So, you can find micropapillary thyroid cancers, which I have seen spread throughout your whole entire neck. But I wanted some sort of difference because I didn't want people to criticize, oh, you're finding all these micro cancers. I'm finding cancers that are 1 centimeter or greater. So, the reason why it's not done is because the healthcare community doesn't want to be overwhelmed. But the way that I look at it is, there are some institutions that monitor small thyroid cancers. I'm not telling you what to do with your thyroid cancer. I just think you should know about it, right? And then you could make your decision. If you want to monitor it, I'm not a proponent for that, but there are institutes that monitor it with ultrasounds every 6 months, and you can do that. But I think women need to know about it and be empowered with that knowledge for them to make the decision of whether they're going to watch it with ultrasounds or have the surgery. And if you have the surgery, just like any thyroid cancer or just like any cancer, early detection is early cure and hopefully less surgery. So like I said, if I can cure you by taking out only half your thyroid and you don't need thyroid medication, that's a home run. You can get rid of it and it doesn't affect, and it could potentially not affect your life. So
I look at this as education is knowledge, education is power. And especially when it comes to dealing with your own body, of course you want to know if there's something there, because you can be proactive about it. You're not going to keep your head in the sand. I mean, maybe some people do, but I know I'm not that person. But that knowledge is powerful. And every woman should have that, especially because it's so much more prevalent in women than in men. And I look forward one day to hearing more research about, like, why? Is it environmental? Is it estrogen? Is it just so many different factors that potentially could play into that? We've already talked about the fact that early detection changes everything. And it's actually a fairly easy, surgery. In general, what can a woman do proactively that supports her thyroid health? Like, what are we missing here?
So one thing that a woman can do that I promote on my YouTube channel and Instagram is, just like you do a self breast exam, do a self neck check. So many times when I am talking to my patient, how did you find your nodule? They'll say, oh, I was doing my nightly routine and I was putting lotion on and I felt a lump. Well, I think every woman should know what their neck feels like. If you do a neck check right now, like I was showing you, just do circular motions where your thyroid is, get to know what it feels like. And then you carry those circular motions all the way out to feel all the lymph nodes in your neck. And thyroid cancer can go to the lymph nodes all the way out to the side and under your ear and down to your clavicles.
Oh, interesting.
So do that. Feel if your nightly routine in the shower. See what your neck feels like, and maybe do it once every couple months. I'm not saying do it every night. This doesn't happen overnight. But if you do it and you feel a lump, well, now okay, my next step is I need to get an ultrasound. So I think that's really important for women to be aware of their bodies. That's for thyroid cancer. If we're talking about thyroid health, thyroid function health, I think it's really important to know that the number TSH, or the lab TSH, is not the whole answer. There are other tests that tell you exactly what your thyroid is doing. So if your TSH is normal, but you don't feel good, you need to delve into that further.
Okay. That's very smart, because sometimes you will have that number and the doctors will say you're fine. And you're thinking to yourself, but no, I don't feel that way. No, I'm not. You have to listen to yourself. And also really good advice about the circular motion, very much like a breast exam. So as we are examining our breast, just keep it moving up and include your neck in that. Such wonderful advice. Okay. I want to ask you questions that a woman can ask her doctor. And folks, we are going to have a document up on the Mom to More website. So momtomore.com under resources, and you'll be able to find this document and download it, and then have these questions that you can ask your own doctor wherever you are.
So number one, what's my thyroid function? So like we just talked about this, I don't feel well. Is my thyroid working appropriately? And how are you going to look into that? So the answer is really going to be your TSH, free T3, and free T4. That's a good place to start. And also something that's also missed are your thyroid antibody levels. So if, and that's not the end of it, but that's a great first start. TSH, free T3, free T4, thyroid antibodies. So that's a good question to ask. Also is, can I have a thyroid ultrasound? And, that at this point, that's what you have to do, since it's not protocol. But can I have a thyroid ultrasound? I feel fullness in my neck. When I swallow, I feel something gets stuck. Can we look into this further? So, those are important things to look at. Function and thyroid cancer are the two main things. The other things are, what is a good diet for my thyroid? If you have something called Hashimoto's disease, and you're struggling, there's a really good diet for Hashimoto's disease. It's really a gluten-free diet.
Interesting.
So that's something that you should ask your physician. I would say, those are really the top three.
Okay, terrific. Folks, those are going to be on my Mom to More website. So don't miss that. Just it starts you on the proper journey for thyroid health. So we're going to be wrapping up in a moment. First of all, I want to say thank you, Dr. Roy, because, when I sat down with you at the conference, I knew this conversation needed to happen. And what I didn't know was how much it would mean to be on like this side of it, right? Someone who has actually lived this. So thanking you for making us aware and changing lives, and for trusting Mom to More with this conversation. To everyone listening, we are not done with our thyroid health conversation. Come back, where we're going to have a future episode where I take you on my own thyroid surgery journey. We're going to be back with Dr. Roy. We're going to talk about the surgery, the decisions, what led to it, and also what 22 years on the other side actually looks like. So stay tuned for that. Dr. Roy, fabulous speaking with you today. I'm so honored and thrilled that we met and that we're able to carry this really important conversation forward for women, because having lived it and been there, I know how vitally important this is. So thank you for your time today.
Absolutely. It's been an honor to be here.
Thank you. Please tell our listeners where they can find you online. And folks, all of this information is going to be in the show notes.
So you can find me on Instagram, YouTube, and TikTok as Goiter Guru. So I share some fun, interesting videos of where I take out these huge goiters, but I also do a lot of education about, what does your ultrasound look like? What does it mean? What should you do if thyroid cancer spreads? So it's very educational too, and some fun things on social media. If you need an expert thyroid surgeon, you can go to thyroidcancer.com. And you can become a patient of ours. And, if you put on the form, Dr. Roy, then I will actually personally call you. I'll review your records and call you and let you know my recommendations.
Right. And someone also could take the records from another doctor and send them down to you.
Yeah.
Right?
And that's
for another opinion. Yeah.
Exactly. And that's what everyone does. They have a workup. They go to thyroidcancer.com, fill out a new patient form, upload their documents, and then I look at them.
Great. Well, thank you for your conversation today. I appreciate your time and look forward to making sure that women are educated and healthy, which is how every woman needs to be. This wraps another episode of Mom to More. If this conversation sparked something in you, hit follow or subscribe and leave a quick 5-star review to help more moms discover the show that's shaping culture. And remember, you already possess the skills and the experience you need to start on this journey, because reinvention doesn't have an age limit.